Well, welcome back. This is our continuing series on introductions to our new faculty in the Department of Surgery at the Medical College of Wisconsin. And we're thrilled to have Dr. Jed Calata here with us today. Jed was recruited in our division of colorectal surgery. And Jed, we're thrilled you're here. Thanks so much for joining us. Birthplace is Reading, Pennsylvania.
That's correct.
So maybe tell us a little bit about Reading. Actually, one of my fellows when I was a medical student is in practice in Reading. I'll have to talk to you about this afterwards. But anyway, tell us about your childhood and how you eventually found your way to medicine.
Yeah, so it's a great place to live and grow up. It's just outside Philadelphia by about an hour. If you play Monopoly, and that's our railroad there on the little bottom of the Monopoly board. So my dad is a rehab physician. He left Temple from faculty to join a rehab-specific hospital in that area.
Oh, wow.
So that's where we grew up. And great place to live and work and just outside the city of Philadelphia.
Okay. And then where'd you end up at medical school?
Yeah, so I stayed locally in the Northeast for college and also for medical school. You know, I went to St. Joseph's University in Philadelphia for college. And they helped me get into Jefferson Medical School, which was kind of the turning point of my career, I really think. They really did a great job of clinical education there. And really is where I found my passion and where I think my mission of what I wanted to be as a physician really came from.
And how did you decide to go into surgery?
And so coming from St. Joseph's, you know, the whole Jesuit ethos of men and women for others really was kind of my calling card going into medical school. So I actually went into medical school thinking I wanted to be the next Paul Farmer. I wanted to give service. I wanted to change things at a macro level. And I think the thing that attracted me to Dr. Paul Farmer's story, you know, God rest his soul, he just passed away.
And a leader in global surgery, for those who aren't familiar with that whole area, but a leader in global surgery, right?
But I like that he saw a problem and he didn't accept the issue. He was passionate about it and attacked the problem as best he could. And so when I went into medical school, I thought that's what I wanted to be. But when I got into the floors of the hospital, the people who matched that same energy in the hospital setting, at least, were really the surgery teams. They didn't accept mediocrity. They didn't accept problems as they are. They worked very hard for a solution, and that's where I really resonated.
Oh, wow. And then surgical residency?
Yeah, I couples matched with my wife, and we matched in Chicago. I was at the University of Illinois Chicago Metropolitan Group Program.
And what area of medicine is your wife in?
She's a pediatric bone marrow transplanter.
Wow, wow. And how long was her training?
8 years.
So almost the same as surgery. Just really crazy.
1 year longer than me.
Oh my goodness! Wow. And so, how do you take us from when you finished your training to how we were lucky enough to have you arrive here in Milwaukee?
Yep. So you know, I graduated fellowship in 2017. I went to University of Illinois Chicago for residency and then Cook County for fellowship. And again, I really loved my training both at University of Illinois and also at Cook County. I was lucky enough to get a job with what's called the Savati Group of Colorectal Surgery in New Jersey, where we were an employed hospital position in New Jersey with Atlantic Health System, but we are the faculty for the Rutgers Colorectal Surgery Fellowship. And so we spent our early part of our career, my wife and I, in the New York, New Jersey area. My wife was working at Columbia at the time. And then she got the call to be recruited back here to Milwaukee to be a scientific director for the Center for International Bone and Blood Marrow Transplant Research here in Milwaukee. And it's an opportunity that she couldn't pass up. And so she came home one day and said, "What do you think about moving to Milwaukee?" And I was lucky enough to call up here, and I had some contact with Dr. Ludwig as a resident. He would come down to Chicago on occasion. And they ended up having the opportunity for adding another staff to the division.
So had you been to Milwaukee at all before we had you here to visit?
So my wife's bone marrow transplant fellowship, which came after her HEMONC fellowship, was here at the CIBMTR, which is the Bone Marrow Transplant Research Center here. And so while I was a fellow in Chicago, I was visiting Milwaukee frequently.
Oh, so you guys were apart for that little period of time.
Yeah.
How long was that fellowship?
Her fellowship here was 2 years, and then so I was here. I was in Chicago to Milwaukee for 1 year, and then when I started the job in New Jersey, we were apart for that time as well.
So you made many trips back and forth.
Oh yeah.
So what's the airline from New Jersey? So did you fly out of LaGuardia?
Newark is the easiest.
Newark.
From where we lived at New Jersey, at least. And there's a direct flight from United, which is quite
Oh,
nice.
okay. So you have frequent flyer miles on United
Just a
then.
bit, yeah.
Yeah, wow. So tell us about colorectal surgery. Why colorectal surgery, and what is your passion in this specialty?
Sure. I think it also comes back to what I originally found passionate about when I first found medicine. You know, I think I come to surgery with a kind of a primary care mindset, and the way I talk about that and why, because everyone asks me why do I want to work with the colon and the anus, is that I think that it's a very sensitive problem for most people, and I feel like they need somebody that they can talk to and relate to describe the problems, and then. From the surgical side, it gives me the whole gamut of surgery, from being, a little bit of a surgical oncologist to benign anorectal disease to preventative medicine, with also being able to do colonoscopies.
Yeah, great point. Well, I'll tell you, Jed, not to embarrass you, but you have had a great landing here in Milwaukee, and the students and residents just really adore you. Give us kind of a little bit of an insight into your approach to education, why you seem to do so well in molding the medical students and the residents, and really stimulating them about surgery, about your specialty, et cetera. I probably haven't phrased that as well as I could have, but to let our viewers know, Jed has just done such a great job, both at the VA Medical Center and on the main campus, in embracing the residents and medical students and really getting the most out of them. And how do you do that?
Well, I think part of it is, for the resident side, is the fact I started my career in a fellowship group. And so I didn't start my career having to always do everything myself. It was a little bit more difficult than that. I had a fellow that I had to give the case to and be able to instruct them on how to go through the steps of surgery. And not only just the steps of surgery, but how to consider and be thoughtful as you're choosing when to operate and when not to operate. And so, luckily here, the MCW residents have been fantastic, and I try to treat them as fellows. I ask them, sometimes I think during residency you get caught in the day-to-day work, and you forget that at the end of your training, you're not training to be a resident, you're training to be an attending. And so I think I try very hard to challenge them to think that way and also operate that way in the operating room.
Great answer. And lastly, Jed, what do you do outside of work?
Oh, right now we have about a 2.5-month-old at home, so I'm mostly making sure that little one stays alive. But otherwise,
Maybe that you and your wife stay alive, trying to take care of him.
It's a her.
Her.
Yeah.
Okay. What's her name?
Her name is Madeline.
Oh, great name. Great name. So Madeline occupies most of your time then?
Right now, yes. And then, with COVID and everything, we haven't been able to explore Milwaukee as much as we would like. But we're trying our best to be brave and go back out in the world.
Oh, that's great. Well, Jed Calata, Division of Colorectal Surgery, thanks so much for joining us today. Really appreciate it.
Thank you very much, Dr. Evans. Thank you very much.